Hello KGI readers, I'm Heejin. It's a great honor to present our study in the Listen to Authors section of the KJR website. Our animal study focuses on the safety of administering intravenous CT contrast agents repeatedly or using both CT and MRI contrast agents on the same day. Post-contrast acute kidney injury, or PCAKI, is generally defined by an absolute increase in serum creatinine of more than 0.3 mg per deciliter, or a relative increase of serum creatinine by more than 50% from baseline within 48 to 72 hours following the contrast agent injection in the absence of other causes of AKI. As the third most common cause of hospital-acquired AKI, PCAKI is associated with extended hospitalization, increased hospital-acquired complications, and higher morbidity and mortality in both inpatient and outpatient settings. PCAKI risk factors include pre-existing renal insufficiency, diabetes, and large doses of contrast agents. Although repeated exposure to contrast agents within a short period is a risk factor for PCAKI, repeat contrast-enhanced examinations within 48 to 72 hours are often performed in outpatient settings and emergencies. For these clinical situations where repeated exposure to contrast agents is inevitable, various guidelines have suggested a minimum interval between two contrast-enhanced examinations. Based on the pharmacokinetics of contrast agents, where 75% of injected iodine and gadolinium-based contrast agents are excreted after 4 hours, ESGR Guidelines 10.0 recommend a 4-hour interval between injections for patients with normal or moderately reduced renal function. For those with severely reduced renal function, a 7-day interval between iodine-based and gadolinium-based contrast agent injections and a 48-hour interval for repeated CT examinations are recommended. On the other hand, the ACR guidelines do not recommend withholding repeat contrast agent administration for more than 24 hours from the prior injection, nor do they suggest a specific time interval between repeated contrast-enhanced CT examinations because the supporting evidence is insufficient to decide on specific guidelines. Due to the lack of sufficient evidence for specific time intervals between repeated exposures to iodine and gadolinium-based contrast agents, we conducted an animal study to investigate the molecular and functional impacts of administering additional iodine or gadolinium-based contrast agents within 24 hours from the initial injection of iodine-based contrast agents. A total of 56 male rats were used in this study, and the rats were equally divided into 8 groups. A negative control group with saline injection, a positive control group with a single dose administration of CT contrast agent, experimental groups with repeated administration of CT contrast agent with 2, 4, or 24 hours between the injections, and experimental groups with additional administration of MR contrast agent 2, 4, or 24 hours after the single dose injection of CT contrast agents. After 24 hours from the last administration of contrast agent or saline, rats were sacrificed and their serum samples and kidney tissues were drawn for analysis. The serum was used in an ELISA and MDA assays. Additionally, serum levels of creatinine, blood urine nitrogen or BUN, and cystatin C were measured. Similar to creatinine, serum cystatin C is an early biomarker for renal function. The mRNA levels of kidney injury molecule 1, or KIM1, and neutrophil gelatinase-associated lipocalin, or NGAL, were assessed using the real-time PCR system and normalized to beta-actin. KIM-1 and NGAL are recently developed indicators of renal function, and they can be used for early detection of PC-AKI. One-way analysis of variance was employed to evaluate and compare the levels of kidney function and kidney injury markers among the control and experimental groups. Here are the results of our study. Compared to a negative control with saline injection, the positive control with a single dose of CT contrast agent did not show significantly altered kidney function and kidney injury markers. Also, mRNA and the protein levels of KIM-1 and NGAL were not significantly different between the negative and positive control groups. The study found significant increases in BUN and serum creatinine levels in rats receiving additional doses of CT contrast agent, with the exception of the BUN level in the group with a 4-hour interval. However, the concentrations of kidney injury markers were not significantly different in all experimental CT contrast agent groups compared to the positive control group. The administration of an additional MR contrast agent after a single dose of CT contrast agent did not lead to significant changes in serum creatinine and BUN levels. Similarly, cystatin C MDA levels and both mRNA and protein levels of KIM-1 and NGAL were not significantly altered in the additional MR contrast agent injection groups. Histological examination with H&E staining revealed no significant changes in renal cell damage and renal cell death. There are several limitations to our study. First, the number of rats in each group was small. And direct translation of our study results to human subjects and clinical situations may be premature because rat models may not perfectly reflect human responses. Nonetheless, our study offers valuable insights for discussing and redefining the intervals between repeated contrast-enhanced examinations. Third, even though the diagnostic criteria of PC-AKI is an increase in serum creatinine within 48 to 72 hours from the injection of contrast agents, we sacrificed the rats 24 hours after the last administration of a contrast agent according to commonly adopted experimental protocols. Therefore, future studies with a time interval of 48 or 72 hours between contrast agent injection and sample collection are necessary. Moreover, as our experiments only involved male rats with normal renal function and did not analyze other AKI risk factors, further research including animals with renal dysfunction or AKI risk factors is needed to generalize our study results. In conclusion, our study found that the administration of an MR contrast agent within 24 hours after the injection of a CT contrast agent did not significantly affect renal function and renal injury markers in rats. These findings support the possibility of performing contrast-enhanced CT and MRI on the same day without limitations on the time interval between them. Our study observed significantly increased serum creatinine levels after the second CT contrast agent administration within 24 hours of the first administration, although the levels of other renal injury markers, including cystatin C, KIM-1, and NGAL, were not significantly different between single and repeated administrations of CT contrast agent. This suggests that maintaining a sufficient time interval, possibly more than 24 hours, between contrast-enhanced CT examinations may be necessary to prevent deterioration in renal function. Thank you so much for listening.